Okay, great. Well, welcome everyone. Thank you so much for joining us this evening. My name is Leah Schaffner. I am the Initiatives Manager at Special Olympics Washington, and I oversee our Family Support Program. Very glad to have you all today. Just a few quick reminders. This is a Zoom meeting, so we can see everyone and hear you, so please keep yourself on mute if you haven't unmuted to ask a question. That helps to minimize the background noise. We are recording, so if you would like to not have your video recorded, you can feel free to turn your video off. That helps us to share this resource after this meeting for people who aren't able to attend, or you can also revisit the recording afterwards if you have other questions. Feel free to use the chat as we go along. Pat and Norma are really great communicators and chatters, so they'll be happy to answer your questions, and I'm sure answer just questions as we go along as well. But I think that's all for me, and I'll pass it over to Della to get us started.
Perfect. Thanks, Leah. Hi, everyone. My name is Della Norton. I'm the Director of Health Programs at Special Olympics Washington. Pleased to have you all here joining us. I just have one additional reminder, a new idea that we're bringing into some of our virtual programming called the parking lot. So sometimes during this forum, we might ask you to put a question or idea that you have in the parking lot, especially if it's maybe not on the topic that we're talking about. This doesn't mean that it's a bad idea. It just means we don't have time to talk about it during this session. So just make sure you have a pen and paper handy, or maybe use the chat box. And an example of a question you might want to ask is, did I get selected for USA Games, which we're not going to be talking about on this session, but we'll try and get you the correct answer. So with that, I will stop sharing and pass it over to Pat and Norma.
Great. Thanks, Della, so much. Hello, everyone. I'm going to share my desktop here and get started. And first of all, can you see my desktop?
Yes, we can.
We can.
Okay, great. I'm going to go into slideshow. All right, there we go. And so what I'll ask Della and Leah, since we're in slideshow mode, that we don't see the chat. If there's a question that comes up through the chat, if you could let us know, and we'd be delighted to answer that. And again, this is an informative discussion. So if you have a question, just ask away. We do not mind being interrupted at all. So officially, good evening. And I'm Norma McKinney and Pat Rowley, who is my partner, both in marriage and in business. And we love working with Special Olympics. And so thank you, Della and Leah, for letting us spend some time tonight with Guardians and Athletes. We have volunteered for Special Olympics in 2020 and had a great time at the bocce balls, basketball, swimming, all sorts. And we love watching the athletes in action. It's very exciting to see every person do their very best for their team. So it's exciting.
Norma, let me just jump in really quickly. I think the screen that is shared is still the editing mode for PowerPoint. So I think your presentation mode might have switched over to a different screen.
Ooh, well, that's not.
So we were still seeing PowerPoint, but it wasn't the slideshow version.
Okay, let's see if we can start this again. Now what do you see?
We still see the editing version.
Really? Okay, well, let me.
I know something you could try is moving it into the slideshow before you share your screen. And then when you go to share your screen, make sure you're on the slideshow version.
Okay, so share screen. So, okay. How's that?
It's still the editing version, but we can see it.
Okay, well, why don't we just, for the sake of time, it'll be a little less elegant, but we'll go from there. So thank you, Leah, appreciate it.
It's still great content, it's okay.
Yeah, so if you are a person that has these two cards, a Medicare and Provider One card, this presentation and conversation is for you, because this presentation is about individuals in the state of Washington who are considered dual special needs. So both of these cards give you a designation to be what is called dual special needs. So that's the main thing for this presentation, that you hold both of those cards. In our presentation today, we're going to talk about the dual special needs, do an overview, talk about eligibility, kind of review of some of the program elements, what enrollees are thinking about from that point, and then again, Q&A. It can be any time during the presentation. We don't have to wait till the end, so please do interrupt us, absolutely, for that. A little bit about Pat and I. I'm a WSU alum, Pat's University of Puget Sound alum. We like to golf, hike, read books, garden, spend time with family and friends, just like everybody else does. And we did a lot of that outdoor last year as we kind of changed up our life a little bit like everybody did. In our community, I'm also president of the Newcastle Chamber of Commerce. We work with the YMCA. We help pack backpacks, lunch backpacks for children in our area who do not have food for the weekend. So we do that as well. And about 250 children just in our area alone have food insecurities that we help give them food for the weekend through our volunteerism at the YMCA. And also I work with our sorority back in Pullman and sit on that house association as well. So we like to be involved in our community and we like to give back just like you do as well. So the one thing that's central to this program called the Dual Special Needs, it is for people who are enrolled in both Medicaid and Medicare. And what it does is it combines these two powerful programs of Medicaid and Medicare into one, and it gives you more benefits than you would have if you had Medicaid and Medicare present. And that's something very powerful for anyone in the community to know that there is more benefits available because of the designation of being a dual special needs. And I think it's important that you see it comes from the Center for Medicare, which is the governing body for both Medicaid and Medicare. So they understand the program and understand its benefits. It is a program that they absolutely support for individuals who are eligible for it. One of the key elements that is not an element of the plan, it does not cancel anything that you currently have with Medicaid. As we all know, Medicaid is a broad program, and there's food and housing and all sorts of things underneath the Medicaid umbrella. And you do not lose any of your Medicaid benefits if you decide that you want to look at the healthcare portion of the dual plan. Everything stays in place that you have, which is fantastic. This is just a value add to your current benefits that you can take advantage of. So I'm going to turn it over to Pat, and he's going to actually walk you through the some of the program elements and such. And here we go. So Pat.
Well, good afternoon, everybody. This program is, as Norman mentioned, it is this is an health insurance program on steroids, really. It's very powerful. Not only does it combine Medicare and Medicaid, but it also combines the capabilities of insurance companies, which gives us even more benefits, which is never a bad thing. Just a little bit about this plan. It's been around, was created in 1998. I believe the first plan hit the marketplace in 2003. There are currently about 12 million people eligible for this plan around the country, and there's about less than 2 million that participate in the program. So there's a lot of people out there that don't know about the program and have not taken advantage of it. And the reason for that is it's not a program that is widely advertised. You will see some advertising about it, but most of the advertising you're going to see, especially this time of the year, since we're in what we call the annual enrollment period, you're going to get bombarded with a lot of Medicare commercials. And this particular plan is not going to be one of them, but Medicare in general. One of the big components about, this slide has two major components. One of the pieces of the dual special needs plan is there is what's called a coordinated care component. Behind the scenes, there is a nurse practitioner, a nurse, maybe a physician's assistant, could even be a doctor that manages the care, literally, of every person that's enrolled in the plan. Now, that doesn't mean they're making daily decisions for you, but they are aware of what's going on, and they're watching and monitoring how your healthcare is being distributed to you. So it's that's a very valuable tool. The other part about this plan is this: it is now permanent. The funding for this plan is now permanent. In 2018, Congress passed permanent funding for the plan, and President Trump did sign that into law. So we don't have to worry about this plan going away. It's here for good and going to be with us forever. And here again is there are three types of people that are eligible for the plan. The dual eligibles, those people that have those two cards, the Medicare and the Provider One card. And then also people with what we call chronic needs. Those are ongoing, lifelong issues. And there is a pathway for those people to get on a special needs plans as well. And also for people in institutions, primarily nursing homes, retirement homes, or assisted living where there's full-time care. So here's another slide that shows that as well, the three different types of plans. Okay, the nuts and bolts of dual special needs. One of the great things about this plan is that there's no premium. There's a zero premium. If you are what we call dual eligible and you qualify 100% for the plan, there's zero premium. It also means there's zero copays. You also do not have to pay your Medicare Part B premium. So there's literally no cost to the plan except for one. There could be a small prescription drug copay. The maximum would be $8.95 per prescription, but one of the insurance companies now has built into their plan where no prescription drugs have a copay. So $0 on copays on the one plan. And that's a good thing because we know prescription drugs can be quite expensive. Other benefits and features of the plans: $3,000 in dental. That covers preventive and any additional services like fillings, a root canal, a crown. So you get $3,000 a year in money to spend at the dentist. Up to $1,200. Actually, that's going to be $1,400 here pretty soon next year. But right now, $1,200 of what we call the personal items catalog. This is essentially shopping at a Walgreens or other drugstores, or actually just Walgreens, but you can shop for items online or through a catalog. And it's everything you would see at a Walgreens or a Bartell's, except for food, prescription drugs, and alcohol or anything like that. But it's bandages, Band-Aids, vitamins, things of that nature. You get up to $1,200 a year in credit. A healthy food card. There are a couple of the plans have a healthy food card where you can order food items. You get a monthly allowance of $75 a month. Yeah, $75 a month. You get to go in and buy healthy food items, and there's a catalog for that. Transportations. There's 48 one-way unlimited medical transport. So you get free transportation to your scheduled doctor's appointments. Hearing aids are also a part of the plan, and there's an annual allowance of up to $1,600 for hearing aids. Talk real quickly about the personal items catalog. I mentioned this just a minute ago, but it's in all the dual special needs plans. One company has a debit card to Walgreens where you can go in and you buy things right off the counter, and things are coded right on the price tag for each item. Up to $1,200 a year. And there's in that bottom right, there's just some example of some of the things you can get: toothpaste, Band-Aids, vitamins, and so forth. And some people need Depends or support hose or something like that. There's a whole catalog of a number of different items available to you. Now, the important thing to remember here, and this is not a duplicate slide, but we're trying to stress the point. This all comes together, Medicare, Medicaid, and the insurance companies, to provide an incredible bundle of benefits, if you will, and all at zero premium and zero copay, except for that little copay on some prescription drugs with some of the plans. And it's a great deal. It is truly a life-changing thing. It helps. Go back to that slide. It takes a lot of things off your plate you don't have to worry about. You don't have to worry about where your healthcare is coming from. There's a network of doctors, an ample network of doctors in the area. One thing, it is not in every county though. So we do have to talk to people and discuss about the county. So it is a little limited that way, but if you're in the service area, you live in the county, why you're available to get on the plan, and it really is a very good alternative for healthcare. So here's some of the things that we see from our clients that are on these plans. We have a number of people. This happens to be one individual, and she wanted hearing aids, and she needed to have her dentures adjusted. Needed new glasses, needed ride to doctor's appointments, and there were personal items that she was paying cash for out of her pocket. Well, this plan covered all that. And she, at the end of the day, every month she ended up with all the things she needed, and she had extra money in her pocket. And her caregiver told us that additional money in her pocket just freed up her lifestyle. She was able to go out for a cup of coffee or maybe a movie when we could still do that. But the biggest thing to the caregiver was the transportation. She now knew that this lady had reliable transportation to every doctor's appointment. She was going to be picked up at her apartment, taken to the appointment, after the appointment, brought back home. So it really is an incredible tool, this dual special needs plan, for people to manage their healthcare and manage all the things around their healthcare. And here's just some more things that what people tell us. We had one lady that was buying support stockings out of her own pocket. Now she gets those as part of the plan, and she saves money on that. Same thing with Depends, the undergarment, disposable undergarments. And one person needed melatonin. So it's now in the personal items catalog, and she doesn't have to spend her own money on that. Saves her a lot of money every month. And here's just a little chart of the amount of money that you can save being on the special needs plan. All of these things on the left side there, they're all now paid for. You don't have any money out of pocket. So you go down through this: dentures, hearing aids, medical transport. We had one client that was spending $300 a month. She didn't own a car. She didn't have a driver's license. She doesn't own a car. And she was paying for transportation, $300 a month to get to her doctor's appointments. So as you can see, it adds up, and it saves a tremendous amount of money. And the biggest thing is that it gives you total peace of mind that you're going to get to and from your appointments. You're going to have all of your needs supplied for, and you're still going to have money left over at the end of the month for disposable income. And here's just some more. Here's just another example of potential savings. When you add all those things up, it's over $7,000. I mean, that's a lot of money. And not only that, it gives you a better quality of life. That top one there, dental care. The medical experts now identify dental issues as being the #1 barrier for a lot of people to good health. They simply don't have good teeth. They have problems with their teeth and corresponding issue with gum disease and what have you. And because of that, they're not able to have a good diet. They simply can't eat the necessary nutritional items to have good health. Once those things are cleared up, they're able to get the dental care they need. They're able to have a good quality diet. And so the dental coverage is just huge. And we encourage people on this plan to take advantage of that. Finally, here's a slide on just how impactful and important this plan is. We have a lady, Carol, who was a caregiver to her brother. Her brother, I believe it was a heart-related issue, I think. And he had a very bad heart attack and stroke. He was on this plan. He spent 9 days in a coronary care unit at a local hospital. And unfortunately, he passed away. I think the bill was $180,000 or $200,000. And this plan paid all of it. There was not one thing that his estate had to pay for out of pocket. And this plan truly does what it says. When it says 0 copays and 0 costs, except for that little copay on the prescription drug, it means it. That's how the plan works. And that's how the plan, Medicare and Medicaid, designed this plan to work with the insurance companies. So it is a really, really great plan. So here's a little bit about us. We, if you're interested in this plan, we'd love to chat with you. Our contact information will be coming up here in a minute. We sit down with you and go over the plan and first of all, see if you qualify. We are required by Medicare and Medicaid to check your eligibility for Medicare and Medicaid. We have an online system where we can do that. Once we qualify or determine your eligibility that you qualify for the plan, then we'll sit down, go over the doctors, make sure that you're in a county that offers the plan, go over your doctors, go over your medications, and see if the plan works for you. We're in a period of time right now where if you are interested in the plan and want to sign up, your plan would start January 1st. So, but nevertheless, we sit down and we offer all those services to you to make sure that this fits for you and make sure it's going to work and do what we know it will do. Then we're there to handle any issues you may have, help you find service provider, doctors, therapists, what have you. A dentist will help you with those services and make sure that you get the care that you need that's easily accessible to you wherever you live. There we go. Everything we do, we comply with privacy commitments, not only from Medicare and Medicaid, but from the insurance companies. Everything that we talk about is confidential. We are under a number of requirements for Medicare and Medicaid about file retention and security of files and so forth. Everything you say to us is done in privacy and confidentially, and we make sure that those records are kept secure at all times. And here's our contact information for Norma and I. Feel free to give us a shout anytime, and be more than happy to go over the plans, make sure you qualify, make sure you're in a county where the plan is offered, and get you set up with your doctors, and make sure that we get the plan set up for you and help you any way we can. And with that, Norma, you're going to come back in here?
Yeah, just a couple of things too is that for this year, one of the plans, Humana, is offering for 2022 unlimited extraction. So if an individual has quite a bit of teeth repair, Humana is doing unlimited over and above the $3,000 allotment, which can be very helpful. And I touch on back to what Pat said about the healthy food cards, in that $75 a month can help with such an enormous amount of food for individuals. So what I really, to just amplify a little bit with Pat, what we have seen the CARES over the last couple of years is kind of look at that whole body approach in terms of, not just over the counter for vitamins and supplements and such that can keep you healthy, but the realization that healthy food, and for athletes, we all know our athletes need healthy food to fuel their performance, and that's here. And so that's been a very exciting ad, and our clients this past year who've enjoyed that have really loved having that additional component. And on some of the plans, they will actually combine the over-the-counter and the healthy, and you get to add more in or to the others. So there's a lot more flexibility now within the plans, and it really just comes down to, as Pat said, the doctors. And finding which ones fit one or two or three of the plans, and then seeing which one's right for you. But there is a lot in here to help with any person, and especially athletes, to help them be their very best.
And I think one thing to keep in mind with this plan is that it's always improving. It is a total moving target. From the time I started in the Medicare business 7 or 8 years ago now, I suppose. I've seen nothing but benefit amounts go up and up and up. For example, on the dental, that started out at $1,000 a year. It's now up to $3,000 a year. So on the transportations, it was 24 transportations. Now Humana and I believe Molina, it's unlimited. So the plan keeps getting better and better and better. Combine that with the fact that we now know it's permanent, it's not going anywhere. It's just a terrific tool for people to use managing their healthcare. And there's plenty of help at the insurance companies with a doctor, a physician's assistant, a nurse or something to guide you through what's best for you to make sure you're getting the services you need when you need them. It's just a great tool. And it's our job. We're trying to spread the word and get as many people on these plans as we can, because we see that there's over 12 million people that are eligible and less than 1 million or 2 million that are signed up. So any questions, if any interest, we'd be more than happy to sit down and chat about it. That's for sure.
So we can stop talking. And if anyone wants to come off mute and ask questions, we'd be happy to spend as much time as you'd like to answer questions.
That was great. Thank you so much.
You bet.
It's exciting to see that the benefits continue to be added on to. So I think sometimes they like to take things away, but this is great that they're just adding more good things.
No, that's very true. Yeah. And I think in the Medicare space, I don't know that we've ever seen anything go down, but there have been years where nothing has improved except for this plan. And the benefit amounts just go up and up.
Hmm.
Chancellor Phil, did you have any questions while we have Norma and Pat on the line?
I guess real quick, we currently have a SMP plan, but we would still be interested in finding out what the other plan options are, because we've never really looked at the different companies. So would we still be able to talk to you guys and figure out if we should stay where we are or if we should move to a different plan?
Sure, Phil. Why don't our contact details are on the screen, and we're going to send this deck out via to Della and Leah, so they can send out, you can have our contact, so you can contact either Pat or myself, and we absolutely can do a research to make sure you're where you need to be. That was our executive assistant, Charlie, in the background. He's a 16-and-a-half-year-old dachshund. So look forward to hearing from you, Phil.
Always good to have the office assistant.
Right.
Yeah.
Yeah. My office assistant has been roaming around as well.
Yeah, we thought he might be quiet because we fed him before, but he's obviously getting anxious.
He's really good at reminding you of lunch and dinner times.
Yeah, very good. Very good. So
I do that well all on my own.
Yeah. Right.
Great. Well, Phil or Chance, any other questions? Sounds like it's a good, easy connection just to schedule a time to meet. Great.
You bet.
Great. Well, Norma and Pat, thank you so much for taking the time and always being such strong supporters of Special Olympics. We're so grateful to have your support and to have you really staying connected, even though it is really an unprecedented time. So thank you so much for being a part of Special Olympics.
Absolutely.
Our pleasure.
Anytime to support, we think is one of the best organizations on the planet. So happy to. So,
really appreciate it. We'll follow up with all of this great information in a little survey for our participants to take, if you don't mind, right afterwards. So thank you all so much. Stay safe out there, and we'll see you at our next Family Health Forum.
Bye, everyone.
Bye, everybody.
Take care.
Have a good night.
Bye. Take care.
Bye.